The current rate of infertility in the United States is 19%.
It's abysmal, and I think it's worse globally.
That's 1 in 5 couples. The rate of infertility in 1990 was less than 1%. These genes haven't changed, but what's happening is these genes are getting activated through all the inflammation we're exposed to, right? The hybridization of wheat, the genetic modification of corn and soy, all the herbicides, the pesticides. Cows don't roam around eating grass anymore. They are locked up in pens and eating genetically modified foods themselves.
And given hormones.
We're eating this stuff with the antibiotics, with all the chemicals. That stuff's crossing in.
And our soil's depleted, so we're not getting the nutrition.
The nutrients, right? Unfortunately, it's becoming something that everybody needs to talk about now.
Hello, friends, and welcome to the Vibrant Wellness Podcast. I'm so excited to be joining you as one of your new hosts. I'm Dr. Alex Carrasco, a board-certified family physician practicing functional and integrative medicine in my hometown of Austin, Texas since 2012. Today, we're diving into a topic that impacts more people than ever before, fertility. We're looking at the root causes behind rising infertility rates through the lens of gut health, detoxification, inflammation, and environmental toxins. Welcome, Dr. Koz. Tell us a little bit more about your expertise in regards to fertility and the alarming statistics that you're seeing.
First of all, thank you so much. It's an honor to be here. Thank you for having me. And it's shocking for me to be here talking about fertility. It's kind of not where I saw my career going, but I think as you've experienced is as you go wherever your patients take you, right? I've been very blessed to be a functional medicine practitioner for 13 years now. And I've gotten to work with everything from autistic children to elderly people with dementia, to autoimmune disease, to heart disease, and then now fertility. And I think anybody listening to this either now has gone through some issues with fertility themselves or knows someone going through fertility, right? And the most shocking thing that I've discovered getting into this field is the current rate of infertility in the United States is 19%.
It's abysmal. And I think it's worse globally.
Yeah. That's 1 in 5 couples. And so I do a lot of speaking now on fertility and genomics and the connections to mitochondria and detox and all these things. But digging into some research, I found a study that shows that the rate of infertility in 1990 was less than 1%.
It's wild.
So we're talking about something that went in the course of 35 years from less than 1% to 19%. There's not, they talk about autism a lot, right, in the media and the kind of the huge rise that we've seen in autism, but the rate of infertility has risen just as quickly. And so unfortunately, it's becoming something that everybody needs to talk about now. And my personal experience with it is it's something that my wife and I went through. So when I met my wife, she didn't really tell me about her health issues at the first few dates. But
no health history disclosed.
Yeah, not right off the bat. But eventually it turned out that she had been complaining of pelvic pain, right? And she had this pelvic pain for years and years before she met me. And she kept going to different OBs and different doctors and saying, I think I have endometriosis, right? Or first it was just what's wrong? And they were like, well, you're fine, nothing's wrong. They did an ultrasound, they would do blood work and they're like, you're fine, there's nothing wrong. And then so she got onto the internet, right? Which if anybody's read my books or followed me, the first chapter of my gut book is why you should stay off the internet when it comes to health issues, right? But that's what everybody does, especially when you go to your doctor with pain and they're telling you you're normal and you're not normal, right? So I don't judge anyone for asking Google or AI now about their symptoms. Right. So everything was telling her, hey, you have endometriosis. And the doctor was like, no. And then once we started dating, I even went to one of her last OB visits prior to us actually getting a diagnosis. And at the end of the visit, the doctor told her to go do physical therapy, right? So the best thing they came up with was go to physical therapy. Well, when we tried to start conceiving, it wasn't working. And so eventually we had to see a fertility doctor. The fertility doctor said right away, I think you have endometriosis. And so they scheduled her for an exploratory surgery. And during that surgery, they found stage 4 endometriosis, which means it's not just in the uterus anymore. It had spread all over her abdomen.
She had adhesions and
Everything.
Yeah.
And for her, the worst part is that her tubes were covered.
Mm-hmm.
So it had started with a tubal study that basically showed that the tubes were blocked.
Mm-hmm.
And then during the surgery, they found that, and there was nothing you could do. So she had to have her tubes removed. Mm-hmm. So it was hard, right? And then IVF became the only option for us. And that's when, really that journey became very personal to me. I had been trying to help her through a functional medicine approach, right? So the classic kind of functional medicine approach is we looked at food sensitivities, we looked at her gut. She was convinced she had SIBO for a while. We tested her for heavy metals. We tested her mitochondria. We tested her for mold. And the only thing I had found in her over the years was a really high level of mycotoxins. Mm-hmm. She had been exposed from the age of 19, basically like moved out of her parents' house. And it's interesting, like 6 months after her mold exposure started is when her pelvic pain started.
Wow. And was that in college? Because I see a lot of patients that just live in very moldy dorms in really bad apartments. Yeah. And then they see me and their health has fallen apart.
Exactly. Right. And this is many years later now. But when we did her mycotoxin testing, it was through the roof. So that was one thing that I had been working on with her was, hey, like you definitely have a mycotoxin problem. We'd been detoxing that. But, in my experiences is, people come to us to reverse disease and sometimes we're able to do that, but sometimes we're not. Right. So at that point, I don't think there was any hope to reverse the endometriosis at that point. We start IVF. It's not working. We have a first failed attempt. We have a second failed attempt. And then I actually started seeing a patient who came to me for Hashimoto's. Mm-hmm. She was a pharmacist at an IVF clinic. Mm-hmm. And I had kind of shared our journey of what we were going through. And she was like, hey, have you ever tried low-dose naltrexone? Yeah. And I had not. And because fertility was something I had not worked a lot with. And LDN, low-dose naltrexone, is something I had used a lot, right? I've been using it in autism and autoimmune disease, all these different things. But I was like, no, but that makes a lot of sense. Yeah. So right away, my wife's name is Mackenzie. I put Mackenzie on LDN. Mm-hmm. We actually had an IVF attempt like 2 months later and it worked, but she miscarried. We took a break. We used LDN again. She stayed on LDN the whole time. The next attempt worked again. Now we have a 15-month-old daughter, which is the biggest blessing in the world.
That's amazing.
And then she stayed on LDN. And now we're actually expecting a boy in a few months.
That's awesome.
So we have like a mantle to our house to LDN that my wife really looks up to. Like she thinks that really helped us.
It's an amazing drug.
It just anti-inflammatory.
Absolutely.
Right? So then, and to me, kind of the most interesting part of the journey is that while she was pregnant the first time is when I really started exploring genomics in my practice. And what I found in Mackenzie's genomics is she had 2 copies for a gene that encodes IL-6, which gives her much higher IL-6 levels. Mm-hmm. There's a lot of research out there that shows IL-6 predisposes to IVF failure and infertility and endometriosis. And so it's my theory. And so then there's also a lot of studies that show that LDN turns IL-6 off.
That's right.
Right.
Yep.
So I believe, and then going a little bit deeper into her genetics, the other things I found in her is that she has poor mitochondrial genetics. She also has poor genetics that for detox, specifically mold. Yeah. Right. She also has 4 different genes that give her anywhere from 2 to 4 times risk of endometriosis. So it is my theory in my wife's story is that basically it was mold exposure that activated her mitochondrial genetics that kind of set off the endometriosis genetics. Yeah. Right. Now, I mean, we're looking at all this retroactively. Right. My kind of goal in life is to work with people proactively on this, 100%. Right? To prevent this stuff. Yeah. But I think it's an interesting thing to talk about because it kind of brings together the whole kind of functional medicine picture, right? Of like looking at the root causes, looking at inflammation. Unfortunately, I don't want to be looking at it too late, kind of like it was with my wife, but it kind of ties everything together as, in the major areas that we look at in kind of the functional medicine process of inflammation, of toxins, of gut, of food sensitivities.
Yeah, that's interesting. When I also started my functional medicine practice 13 years ago. So we're
cool.
probably about the same age as my guess. And, when I was a second year resident, I got pregnant with my first child. And I didn't have endometriosis. We got pregnant very easily, but my parents had a really long fertility journey with me. Like it took them 9 years to get pregnant. So I suspect my mom had it. And I was their only one. They couldn't have any more. They had given up back in the 80s. They did IUI. They couldn't afford IVF. And they were like, I guess we're just done. Then they got pregnant. And then they tried again. They couldn't. So I was always worried that I'd have issues with fertility. But I got pregnant with my daughter. And I was a second year resident. So I was taking working 80-hour weeks, taking Q3 call. Very stressful. I was probably on the inpatient service. And I remember I was on call probably maybe month 7, 8 of my pregnancy. And I was feeling terrible. So I texted my OB. I said, I feel horrible. She said, okay, go do a UA, please. Did a UA, high proteinuria, checked my blood pressure, crazy high. My OB says, you have to leave, call, and you need to be admitted to the hospital. So I had to scramble to find a co-resident to take over for me. And then drive across town to another hospital because I didn't want to check in with all my other co-residents.
Makes sense.
But so I was diagnosed with preeclampsia, and then I was put on bed rest for the rest of my pregnancy, and I ended up having to be induced and delivered 3 weeks early because my blood pressure got so high. And my mom had preeclampsia with me, and actually I was born 4 weeks early. And I was 4 pounds when I was born. So it's like there's an interesting probably genetic and genomic component there. So I give birth to my daughter after I'm induced. Thank God she comes out healthy, strong, 7 pounds, even 3 weeks early.
Nice.
But then I hemorrhage.
Wow.
And then I hemorrhage so much that my hemoglobin drops to 5.
Wow.
And so then I get a transfusion.
Yeah.
And on my second unit, I get a transfusion reaction. So I got covered in hives. I was like, I think I'm going to have to go to the ICU. Like it was so scary. Benadryl, lots of Benadryl worked. And then I got to go home, maybe a day or two later, but it was very scary and it was a very traumatic experience. And when I was a resident, I was not eating clean or healthy. Yeah. I was eating garbage. I was trying to just stay awake through the night. The stress was really high. And so, in a way, not in a way, I think that, pregnancies in general, just the bar is so low. Mm-hmm. Like if you're pregnant, let's just give you an over-the-counter prenatal, at least back 15 years ago, and let's hope for the best. Yeah. No digging. So I was really scared after that because I wanted more children. And I thought I need to reverse engineer this and figure out how to support fertility for myself and healthy pregnancy and also for my patients. So then I was able to, through that experience, learn about nutrigenomics as well. And I found out that I had, double MTHFR mutations and COMT mutations. And then when I looked retrospectively at my labs, I think I pulled them after the birth. My B12 was like 200.
Oh, wow.
And my D was probably, 17. It was horrible. Yeah. These are not standard tests that doctors are looking at for their patients. So I feel like we do them a disservice. So in my practice, it sounds like in yours, we're trying, a lot of my patients come and see me for preconception prep because I figure if we can optimize everything beforehand, give me ideally a 1 year, running start. But some of my patients are like, well, we want to try like in 3 months. Okay, we'll do our best. But yeah, we want to look at micronutrients. We want to look at genomics. We want to look at gut. We want to look at toxins. So, and all of it's so interrelated.
Yeah, I think one of the most important, I love working with women when they're like, hey, would like to get pregnant in the future, right? Like what's the first steps? And to me, it's the inflammation, right? But what I always like to focus on first, actually, like for me, the first thing with a woman that's pregnancy planning is toxins.
100%, because it takes so long to detox.
it takes so long to detox, and they've done studies on the
Yes.
umbilical cord blood
Yes.
now, right? Where they find over 100 different
Yeah.
toxins crossing into the placenta,
Yes.
right?
Mhm.
And so the best way to protect the baby is detox the mother, right?
Right.
So if I have a woman that's coming to me, it's kind of like you're getting the full gauntlet of testing. You need to do gut testing, right? You need to get rid of candida.
Same.
You need to test heavy metals. You need to test mold. You need to test environmental toxins, get that stuff all out so that stuff's not crossing the placenta, right? That's what you have too much of. And then like you're kind of talking the micronutrients and the vitamin D. You got to give them what they don't have enough of, right? If you don't have it, how's the baby going to get it, right? When we were going through our OB visits while my wife was pregnant, at 37 weeks, the doctor was counseling her about group B strep testing. They're like, we're going to test your vaginal flora for group B strep, and explaining like, if you have it, the baby could get sepsis and die.
Right.
Don't worry. If you have it, we'll just load you up with antibiotics when you go into labor.
We'll just clean out the microbiome.
Yeah. Right. And everything will be great.
Yeah.
And I had told our doctor, I mean, I would usually sit in the corner and kind of not really, I for the most part would not talk about what I do. I kind of like to watch the process as a spectator. And me, you know, I have a book on gut health, and everything you learn in functional medicine is start with the gut, start with the gut, start with the gut. There are endless studies now that kind of say when an infant that's born doesn't get a good gut microbiome, doesn't get a microbiome, every kind of disease is exponentially at risk, right?
Yeah.
So I'm like waiting for this line for the OB to be like, and you know, we're going to support the microbiome through, and it was just nothing. Yeah. It was just like, and so you're, you know, still now in 2025, sadly, like most kind of traditional doctors aren't even talking about it, right? Like, and then that for me was just kind of devastating that like, you know, we both live in this functional medicine world, which feels so big sometimes.
It does. Yeah.
But I think there was like 6 OBs at this practice that we were seeing, and it was just like a non-factor. I mean, and I'm not someone that trashes traditional medicine just totally, because I think that, you know, if there's a group B strep infection, yes, I want to protect the person. I want the person to die, but there's also things you can do to support the microbiome and just be aware of that, right?
Or even when, you know, people get C-sections and you say, well, can you swab the vaginal microbiome and, you know, into the baby's mouth or nose? And a lot of doctors don't want to do that. I don't know.
Yeah, exactly. Right.
But I think to your point, you know, the gut microbiome is kind of the, I guess, the source, but you know, the maternal microbiome ends up being, you know, the oral microbiome, the gut microbiome, the vaginal microbiome, the ovarian microbiome. Like we have so many different microbiomes within our body that are interconnected that also play a role in fertility support. So supporting the gut microbiome is primary because that also affects all of the other microbiomes.
Absolutely.
Yeah. I had a patient who came to me after a miscarriage, and when I ran her toxins, she had Stachybotrys, you know, off the charts. And she told me that she worked in a building where there were a lot of mystery illnesses, people with autoimmune disease, cancer, like really weird stuff, all clustered together. Yeah. So, you know, we detoxed her and she stopped working there. Yeah. I think I put her on LDN as well. Got pregnant, you know, quickly. Yeah. So it's amazing how a lot of people in general don't believe that toxic exposures are a problem.
Yeah, I've been trying to figure this out as like, you know, being both of us traditional MDs that went into the functional medicine world. I had no problem with my patients talking about diet. Right. I had no problems talking about gut. I was scared to get into detox. Yeah. And I was trying to like, did something happen during medical school and residency where they really like poison us to like be afraid? Or I don't know if it was just a personal thing to me of like why I was kind of scared to go into detox.
And the weird thing is that there's occupational medicine, and I think they actually focus on toxic exposures, but I don't know if it's more it's more work related. So we just think our houses are safe. You know, we're not going to live in, you know, or work in condemned buildings, but it's so prevalent. I see it so much in my patients.
One thing that's for sure is like in traditional medicine, we focus on acute toxicity, right? So that's like a hard, quick exposure, and there's like acute symptoms. Yeah. And the way that I like to describe it is like our total toxic body burden.
Yes.
That's the difference in functional medicine, right? We're all born with a bucket, right? And we all have a bucket that's a different size. And I think that's genomics that plays a role in that.
Yeah.
But we fill that bucket with bad food, with stress, with sugar, with mold, with heavy metals, with glyphosate, with plastics. And eventually that bucket overflows into disease, right? And so that's one of the ways I like to explain to my patients, like, because they're like, well, why doesn't my regular doctor talk to me about mold or heavy metals?
Or why doesn't my spouse feel the way I feel?
Yeah, that's
because that's
one.
hard.
Right. Yeah, exactly. So you can have people living in a moldy house and only one of them is sick, right?
Super
like that's
sick and everyone else
classic
is fine.
for my practice is like it's typically only one person in the house that's sick. And like, that's a lot of those variables that we talked about. Like, what are your vitamin levels going into it? What are your genetics going into it? We want to empty that bucket and it's not everybody with toxins has disease, but yet is always the thing I want to say, right? And so you could take someone with a lead level of 20 or 30 and they're fine. Like they don't have disease yet. And you can have somebody with a lead level of 10 and they have high blood pressure and they're on their way to dementia and osteoporosis and all of these things. So I think that's one of the difficulties that traditional medicine has with it is like, we objectify, like if your blood pressure is 130 over 80, you're in stage 2. If you're 140 over 90, right? We have stages.
Yeah.
Whereas with the toxins, I don't think you can really do that. To me, it's like it either is or it isn't.
Yeah.
Right. And so there's not like a set level. If you get to this level of whatever toxin that you're going to get this disease. Right.
And I think it's also hard because then you can't set a standard. And since the medical system really focuses on standards and standard of care, then you can't protocol it out for people. So
but I think anybody could agree that there's no normal level, right? Like we shouldn't have a normal level of plastics in our body, right?
Exactly.
We shouldn't have a normal. So I think that's a way like to get over it is like, sure, we don't like, yes, it doesn't correlate with other things in medicine that like this definitely causes this. But I think you ask any person off the street, like, what do you want your level of microplastics to be? It's like,
what would you like your lead level to be?
Right. I'm going to go with
you want a 6? No, I want none.
Right. Yeah, and so for me, it was a barrier. It took me a couple of years of practicing before I was able to like really dive into environmental toxins.
Yeah.
And I had to because I saw people that weren't getting better.
Right.
Right. And when I was writing my book on toxins, mold has become like the second most common thing I treat. So for me, it's like SIBO dysbiosis as a gut doctor, and then mold toxicity is number 2.
Yep.
I went back to the pathologic basis of disease, which is that huge textbook from med school that's supposed to have, it's 1,700 pages, the smallest print you could possibly put on a paper, and everything that could go wrong with the body, right? Well, I was going through the index on mold, like what do we have on mold in here? Was I just not paying attention during those classes, or why did I have to like spend all this time in functional medicine training to learn about mold?
Right.
Well, in that textbook, there's 2 pages on mold, and it really just focuses on mold allergy.
Right.
Right. And so if you go to your regular doctor and you bring up, hey, I want to know if I have mold, they're going to test you for allergies, which is kind of irrelevant for us. I mean, I think people that are allergic to mold are actually pretty lucky, because if they walk into a moldy building, they're going to feel it, right? And they need to get out. Whereas somebody who's not, who can live in that building and not feel it, they're the ones that are going to get toxic.
Right.
Right.
More silent.
Right. And so mold toxicity is just not even discussed in the pathologic basis of disease.
Right.
Whereas like we're both practitioners, have been practicing for a long time, and it's one of the most common things we're treating.
And what's interesting to me is I believe even in the Old Testament, they talk about mold and how to not live in moldy environments.
Yeah.
So it's not like it's new.
Yeah.
This is not news.
Right. And this is my biased opinion. I mean, I think one of the reasons we don't talk about it is there's not a pharmaceutical drug necessarily that you need to detox mold. Right. For me, the protocols that I use is step 1, and the only step that really matters is to stop exposure. Right. Right. You were sharing that story that you had with a patient. It's one of my favorite stories is I had a woman, that same thing, and we tested her. She tested positive for mycotoxins. She found them in her home, in the school she was working in.
A lot of
She
schools.
moved out of her house, moved in
Mhm.
with her parents, quit her job. And I was still kind of early on in my career, and I was
Yeah.
like overwhelmed. I was like, okay, she's completely flipped her whole life around already. And I can't even guarantee if we get this out that her
Right.
her goal was pregnancy.
Yeah.
For me, it was just to get the toxins out.
Right.
Well, she moved out, quit her job. 3 months, we got her mycotoxin levels down to 0. 3 months later, I got an email that said first to know, and she was pregnant.
Yeah.
I actually
It's
just
the
ran into
best.
her husband with their son
Aw.
at the mall the other day. It was really cool. So for me, like with the discussion of detox, it all depends on stopping exposure.
Right. I think it becomes challenging. So, for example, I'll have patients that will find that they live in a moldy home. And when they're renting, I'm like, thank
Yeah.
goodness,
Yeah.
just get out of there. It's
Yeah.
hard when you live in a moldy home because
Right.
it's so incredibly expensive.
Yeah.
Insurance companies don't really want to pay.
Right.
There have been some big cases that have been won actually in Central Texas in the last year.
Really?
So now there's a little bit more precedent, but it's hard. And insurance companies, they just deflect,
Right.
So your homeowners deflects to your builder will deflect, say, to the subcontractors, to the roofers, and then they will maybe pay a little bit or maybe they'll go bankrupt.
Right.
So it's very hard, it's very hard to do.
The other massive problem is like with Vibrant, we do mycotoxin testing, right? Urine mycotoxins, right? Because when mold's present, it releases spores, which
Right.
is how it replicates,
Right.
and it releases mycotoxins, which are its defense mechanism, right? If I have a patient who has a positive urine mycotoxin test, and I tell them, hey, you need to test your house for mold, it's like 99% of the people they call are going to come in and test their house for spores, right? So the most common type of mold testing for the house is the inspector will come and test the amount of spores outside and the amount of spores inside.
The air testing.
Right.
Mm-hmm.
Yeah.
Yeah.
Well, spores are a lot bigger than mycotoxins.
Mm-hmm.
So you can have a home that tests negative for spores, but actually has mycotoxin testing, right? So that's another barrier where people are like, well, when I bought my home, I got it tested for mold. And I'm like, well, what kind? They're like, I don't know, whatever my realtor told me to get. And I'm like, well, that's probably spore testing.
Yeah.
So it's a crucial thing to anybody listening to this too, that like, if you need to check if your house actually has mold, you got to do mycotoxin testing, right? Because then you can match it up to your body. Right.
What's your favorite way to do that?
It's dust.
Yeah.
EMA testing. Yeah. So you do an EMA test of your house, you do a urine mycotoxin test of your body, and you match it up. Because the other really hard part about treating mold is like, I've had patients that are like, they'll test and their house is negative. But they're like, when I was a kid, my parents' basement used to flood all the time.
Yep.
Right.
Yeah.
And so some of us retain it.
Yes.
Right. And that's some of what happened to my wife is why she had such high levels. She had been exposed for years and years. We found genetically she didn't detox well. Nutrition wasn't great, right? And so it was still lingering in her body for years after even being out of it.
Yeah.
Right.
So it can linger in your sinuses. It can linger in your gut.
Yeah. All over.
Yeah.
Right. In your reproductive organs.
Yeah.
Right. And stimulating inflammation, damaging the mitochondria. So it's to me, it's a really common thing I treat now, and it's hard because it goes against kind of like the traditional world, right? Like traditional world, they're going to test spores. If you go to your regular doctor, they're going to talk about allergies, right? So it's kind of like, we need stuff like this. We need to get the word out to the general public. Like, hey, this is actually a really big deal. And it's a little bit different than the way your traditional doctor is looking at it.
So how do you detox your patients?
Stop exposure.
Right.
Glutathione. Now I'm doing, so one of the things I'm really doing now is I'm personalizing it using genetics, but my kind of classic mold protocol is I would use liposomal glutathione. Liposomal glutathione typically is a liquid. Glutathione is the body's master antioxidant. What detox is taking fat soluble toxins, right? So any of these toxins we talk about, everybody thinks about their liver as their detox organ, right? Well, what your liver does is take those fat soluble toxins and break them down through phase 1 and phase 2, making those toxins water soluble. So you pee, poop, and sweat them out.
Right.
That's all detox is, right? I always like to remind people that your main detox organs are actually your barriers, right? It's your skin, it's your lungs, it's your gut, right? So our barriers try to keep those things out. If they get in, our liver breaks them down to make them water soluble, so we excrete them. Glutathione is the only thing that works on phase 1 and phase 2 of detox, right? So if you pull up a picture of the liver and the antioxidants and the nutrients that are used, glutathione is the only thing that hits phase 1 and phase 2. So I love glutathione. My favorite tool for a mold detox is infrared sauna.
I love sauna.
Yeah. So I did studies with a colleague of mine in Martha's Vineyard where we would do urine tests on patients before and after infrared sauna, and we would show higher mycotoxin levels in the urine after the sauna.
Oh, wow.
So kind of showing it was coming out, helping it not only in the urine, but also in the sweat. So I love to use infrared sauna. I will use alpha lipoic acid, omegas, a binder, SBI Protect, which are IgGs.
Yes.
A really kind of cool thing that is a pharmaceutical that I don't use all the time, but cholestyramine is basically one of the ways we carry out toxins is in our bile, right? And so cholestyramine, colsevelam is a pharmaceutical that was designed to lower cholesterol, right? Because bile helps us carry out cholesterol.
Right.
As we're excreting bile through our gut, our body is designed to reabsorb some of it, right? To make our liver's job easier. Well, this drug, colsevelam, that they came up with, or cholestyramine, blocks us from reabsorbing bile. And so it helps lower cholesterol by getting the bile out.
Right.
I don't know who it was in the functional medicine world, but they realized like, hey, we can use this drug. If bile's carrying out toxins, we don't want to be reabsorbing that bile if it's full of mold, right? So we use that drug to kind of keep the bile excretion. So that's another thing. Sometimes I will use, not all my patients love pharmaceuticals, right? So a lot of people will be like, I don't want that. I don't care if it takes longer. So those are kind of like the mainstays for me. And anything that you really like that
I do like to support bile flow. Because I think one thing we could touch on is also the liver gut axis, right? Because that can also contribute, right? So if your liver, they kind of communicate to each other.
Yeah, absolutely.
And if the communication pathway is not working very well, then that can also cause, your gut microbiome can impact your liver and can impact detox, and then your liver also can impact your gut microbiome, and then that can cause a big mess. And then if you've got leaky gut at the same time, that's your membrane that you're trying to keep closed. It's, it ends up being an intertwined web, right? Yeah.
For me, that's an important point is like, because, when we're starting with like looking at the root causes and testing, some people are like, well, do we start with the gut first or should we detox first? If you're not moving your bowels every day, you're not ready to detox. Right. So I will, unless somebody's really in a worse place with their toxins, I will start with the gut. And you want to treat the dysbiosis, you want to treat the SIBO. Because if you don't do that, you're going to be kind of in that same mechanism, reabsorbing toxins, right?
How do you support your patients that have, kind of constipation that won't go away or that have kind of slow transit time?
Yeah. So the most common condition I treat is SIBO, small intestine bacterial overgrowth. The most common presenting symptom is constipation. So I will definitely test and treat SIBO if I suspect that. Candida, as far as like a gut and some people say candida. I always kind of know. My parents are from Poland. I learned Polish before I learned English. So I kind of just say English isn't my first language, but I don't know the right way to say it.
I think Candida, I say candida because Spanish was my first language. So,
all right. So candida, that is so common. So I will always treat that.
And are you using prescription drugs for that typically, or what are you using?
For Candida, I love to use nystatin.
Yeah, I love it.
People are the same thing. They're like, you want to use a pharmaceutical. Nystatin is one of the only drugs that's not absorbed.
Exactly. And it's gentle and babies can use it.
Yeah. So, 99% of drugs were designed to be swallowed, broken down, absorbed through our gut and into our body. Nystatin never gets absorbed. So I kind of am on this preach where I really should be an over-the-counter med. Like it's safer than ibuprofen or Tylenol.
Yeah, agree.
And it does basically one thing, which is kill Candida. So it's kind of a beautiful way to treat it.
Yeah.
in the rare cases where we don't have a gut issue to treat and somebody just wants to move their bowels a little better, I love liquid aloe, right?
Yeah.
Like liquid buffered vitamin C,
Yep.
Which is just vitamin C mixed with like magnesium, potassium. Those are just straight like mag citrate.
Love it.
Yeah.
Yeah.
So those are kind of some of my go-tos just to get the bowels going.
But when you're in your preconception population, I'm sure you see it all the time too. A lot of subclinical hypothyroidism. Sometimes you probably uncover Hashimoto's.
Yeah.
And so, the web gets more tangled.
Right. Yeah. Yeah. I mean, looking at hormones is a huge one. And all of it's connected, right? Like one of my mentors in this field, Dr. Susan Blum, she kind of taught me to think of the thyroid as a sponge for toxins.
Right.
So it kind of connects that picture of like, again, like in regular medicine, we were very quick to diagnose Hashimoto's or low thyroid and say, here's synthroid, right? Our patients are not usually happy with that. They're like, well, why do I have low thyroid,
what's
right?
the reason?
Right. So gluten, right? Food sensitivity, right? So you got to test them for food sensitivities. And then it is like the heavy metals, the mold, the plastics, right? Because all Hashimoto's is an autoimmune attack on the thyroid, right? Well, it would make kind of, to me, again, things that make sense, I like, right? Well, we could say we have no idea why your immune system's attacking your thyroid, or we could say, well, if your body's full of toxins are fat soluble. If they've been absorbed into your thyroid, it would make sense your immune system's trying to kill your thyroid or get rid of it because it's full of all these poisons, right? So that, the picture kind of always goes back to like the root cause of like, we got to get the inflammation out of the body.
No, that's wonderful and fascinating. Could we talk a little bit more in depth about SNPs?
Yeah.
What have you found to be kind of the most important ones in fertility challenges, or what should women be thinking about asking their doctor to check? I think a lot of people know about MTHFR, but it kind of stops there, I think.
Yeah. So that, I like to call it the mother effer gene.
Totally.
Right. When I first started practicing, I was my own receptionist. I was my own everything. And I had this patient that called one time and he's like, do you work with that the mother effer gene?
Yeah.
And I was like, I do.
Yeah.
So 12 years ago, I went to a conference that was an entire 3 days just about MTHFR, right? So most people probably listening to this are like, yeah, I know the MTHFR, and it comes down to methylation, right? And MTHFR can be blamed for everything pretty much, right? Like infertility and high blood pressure and heart disease and depression and anxiety. I left this conference 10 plus years ago saying like, screw genomics, I'm not going to do genomics because there's no way that one gene can explain everything, right? So I kind of hated working with MTHFR. I hate when, I have so many people that still come to me, they're like, I need to talk about MTHFR. Well, now when I do a genomics panel, we are doing hundreds of genes, right? Yeah. The methylation pathway alone has like 15 genes in it that we can look at, right? Some people need folinic acid. Some people need folic acid.
That's right.
Some people need just B12 or choline or, so it's so much more to that than that, right? So specifically, like when it comes to fertility, there's progesterone receptor genes, right? Where that certain women you can look at genetically and say that they need way more progesterone, right? So there's potentially women or clinicians listening that are like, yeah, my patient kept having miscarriages. And then kind of like in traditional medicine, they're like, well, if you miscarry, then we're just going to put you on progesterone.
Yeah, after your third, we'll just put you on progesterone.
Right. So now there's a SNP for that, right? So now instead of a woman going through 3 miscarriages, it's like, hey, the first time you get pregnant, you're going to go on progesterone, right? And that's the thing that I think anybody who's experienced going through infertility or IVF is like, anything we can do to take away some of the pain and suffering that people go through is worth it, right? Yes, like for people to not have to go through what we went through. And there's people with much worse stories than us that going, for years of going through it, right? So that's a great one. Even at a simpler level, there's vitamin A genes, right? So if you're genetically, you have a harder time absorbing vitamin A. So you can put someone on a vitamin A supplement, CoQ10. CoQ10 is one that goes for men and women, right? So there's a SNP for CoQ10 that shows that some of us absorb CoQ10 worse, right? There's a gene related to FSH, which actually women with it have lower ovarian supplies, right? I'm working with a woman right now who's in her late 30s, she didn't come to me until late in the process, but she's going through the egg retrievals in IVF and she keeps getting 1 or 2 eggs, right? And that's not normal. Like, you know, a lot of women that go through IVF, they're getting 20, 25 eggs. Well, she has this SNP that gave her a lower ovarian supply, right? If she had known that when she was young, she could have frozen her eggs early on, right? So that's another one. So I think in just the big picture in the genomic discussion the big point I'd like to make is, unfortunately, like, I'm using it to treat stuff right now. I would love to do it preventatively. Yeah. Right. So like for us, you know, my wife has these really bad endometriosis genes. My own story is like how I got into this field was depression and anxiety. I have still some of the worst anxiety genes out of any person I've ever tested. So our daughter, we did her whole genomic panel when she was like 2 months. Like, my great fear is that she was going to have my depression and anxiety stuff, which she did not get. But she did get some of my wife's like endometriosis stuff. But we can have a strategy in place to kind of, you know, the goal is prevention, not reversing, you know, ideally. So CoQ10, vitamin A, MTHFR, you know, methylation is related, and that's, you know, these are easy ones to support. PEMT. Yes. So those are different SNPs, and then you know, glutathione, vitamin C. A really interesting gene that I've found is that has so many connections that are outside of what we learned in medical school is like factor V Leiden, which we learn about clotting. But people with factor V Leiden are really, really high risk for heart disease, coronary artery disease, but also infertility. I had a patient that she's in her 60s now, but we found the factor V in her, and it led me to find coronary artery disease in her. But I was just asking her, she has 2 kids, but I was like, hey, when you were going through in your reproductive years, did you ever have any miscarriages? And she's like, I had 3. Right. Wow. And that's something where you could, you know, factor V Leiden, what it does is increase your risk for clotting. There are supplements like nattokinase, lumbrokinase, picnolol, which are natural ways to kind of improve that. But then also you have the people that go through multiple miscarriages that are then put on aspirin, right? And it's kind of just like another shotgun thing. Like, we don't really know why we're doing it. I think a lot of those people probably have factor V or another clotting gene that's predisposing them to miscarriages, right?
And so probably a lot of those patients maybe only have like one. So then it looks mild, and even if doctors checked, maybe they'd say, well, you know, it's not double.
Yeah. So the basics of genetics, right? With any gene, you can have 0 copies, 1 or 2, right? You get 1 from mom, 1 from dad. Sometimes having 2 SNPs within a gene is good. Sometimes it's problematic. A fun thing is like when I got mine back, I got to watch my parents fighting over who gave me which one. With our daughter, I pull up our genetics, and I'm like, well, she got that from you. She got that from that one she got from both of us. So it's kind of, it can be fun that way. Also, genomics, genetics in general is not a diagnosis, right? So people that are kind of diving into it, like, just because I had multiple genes that gave me 300 times risk of anxiety and depression does not mean I needed to develop anxiety and depression, right?
It's just potentials.
Right. Just because you have genes for heart disease or dementia or diabetes or obesity does not mean you will develop those things, right? It is a risk, and then it's a modifiable risk, right?
The power of epigenetics in our lifestyle and our diet and our supplementation. But I think that speaks to why it's important to do that kind of testing on all patients if they're up for it. I do recommend it for all of my patients.
It's not for everybody, right? Some people are scared, right? A very memorable genetic case I had is I had a woman who I was meeting with her about her husband who was 62 and in full-blown dementia, which was really sad. But the woman was crying to me like, I wish we could have prevented this. She had 2 sons, and I was like, well, like, she had her husband's genetics, and I was like, he had some of the dementia risks. And I was like, well, let's do this on your sons to prevent it for them.
Right.
And she stopped right away. And she was like, no,
they don't want to
no
know.
way. She didn't even give them a choice.
Oh, wow.
She was like, they couldn't handle that.
Yeah.
Right. And I've had a few people that are like, listen, I don't want to know.
Yeah.
To me, information is power. Like, I want to help people. So if we have things that we can modify, let's do it. But I get it. I get why some people are like, especially when it comes to like the cognitive decline and brain stuff, they're like, I don't want to know.
Totally. I get that 100%.
Yeah.
So we were talking about the dramatic increase in infertility in the United States when we began our conversation. What do you think is leading to that? I mean, after kind of all the things that we've talked about, what would you tell patients or clinicians that are listening? These are kind of the top 5 things, and then here are a couple things that we can do for each of those things. We can kind of talk about it.
It's like, it's even hard to say out loud, right? How do we go from less than 1% to 19%?
In
right?
25 years? No, 35 years. Yeah.
From 1990 to 2025, right? Yeah. Like that shouldn't be, right?
Right.
I think it's our environment, right? I mean, Hippocrates, the grandfather of medicine, said all disease begins in the gut, right? He said that 3,000 years ago. And for me, when I talk about the gut, to me, the most important thing for people to understand is the gut is the gateway inside, right? Your gut is a barrier, right? So everybody talks about this term leaky gut, right? A lot of people don't even know what it means.
Right.
Well, your gut is no different than your skin, right? But your skin is super thick. Like your skin has 3 layers of cells.
Right.
It's very hard for the outside world to get inside, whereas the gut is a single layer of cells, right? So you'll have the people that are like washing their hands 20 times a day, but then they'll go to the gas station and throw anything in here, right? Yeah. Well, I think what's happened over the last 35 years is the hybridization of wheat,
100%.
The genetic modification of corn and soy, all the herbicides, the pesticides, everything that we're spraying on our food, right? The proteins of our food don't look like they used to, right? Cows, like dairy, right? Cows don't roam around eating grass anymore. They are locked up in pens and eating genetically modified foods themselves.
And given hormones.
Their proteins don't look like they used to, right? So, and then we're eating this stuff that's like with the antibiotics, with all the chemicals, that stuff's crossing in.
And our soil's depleted, so we're not getting the nutrition.
The nutrients, right? Our genetics have not changed, right? We're talking so much about genetics. These genes haven't changed, but what's happening is these genes are getting activated through all the inflammation we're exposed to, right?
Yes. So caveat real quick. Let's talk about Weston Price and his work, because that was interesting work that he did in the 1930s. I don't know for listeners out there, but Weston Price was a dentist in the United States who then went to different countries. He started in the French Polynesia, and he noticed that they had beautiful, perfect teeth and beautiful arches and no disease. And then he traveled around the world and studied tribal cultures, and he saw that they had beautiful straight teeth and they were strong and healthy and hardy. And then as flour and sugar were introduced to those places, dentition of the people changed and the health of the people changed. So I think it just is another way of, it just shows this also another way of showing what we're talking about. I think in our country, it's probably accelerated, worse because we're getting hit on all ends. And that doesn't even talk about EMFs, our very stressful lives. We're sedentary. We're in front of screens all day. I think we're just being bombarded from all sides.
Yeah. And I think that kind of brings up, I think, the point that I like to talk about the most, that out of all the things we've talked about, to me, like what I like to preach that my patients absolutely hate me for is the most important part of health is our mental, emotional, spiritual, and social health.
Amen.
Right. And people come to me for like a root cause, but when I start talking about stress and trauma and all these things, they're like, no, like, I don't want to deal with that. Just give me the right supplements, give me the right diet. Well, I love to, if you're coming to me for gut health, I love to talk about the gut-brain connection.
Yeah.
Right?
So we have to talk about the vagus nerve.
Right. Exactly. The vagus nerve is my joke is what happens in your vagus nerve doesn't stay in your vagus nerve. Right. it operates autonomically,
Yeah.
right? Sympathetic versus parasympathetic, right?
Mm-hmm.
And people are sympathetic response like throughout evolution was like life or death, right? Sympathetic is activated because there's a bear in front of you,
Right.
and the blood and energy go to your brain and muscles to survive, right? If you survive, parasympathetic is activated and the blood and energy go to your gut for digestion. The first thing we do is wake up and we check our phones, right? And there's news and there's social media and there's texts and there's emails, right? We sit down for for breakfast, and we're watching more of the news or responding to stuff. And the gut's like, hey, I need energy to function, to break this stuff down. And the mind's like, no, there's a bear in front of you. You need to get away, right? And so your gut is completely shut down. The number one thing that happens when you're living in that sympathetic response is leaky gut, right? And so now you're eating all this food with all these chemicals on it, right? And that's genetically modified. And that stuff is now getting through your gut barrier.
And your gut barrier goes like from this to this.
Exactly, right? It's wide open and it's all being set off from the trauma, right? From that fight or flight response. So
I often tell my patients that, you know, whether a lion is really chasing you or you're perceiving that it's chasing you because you have all these responsibilities or, you know, things that you're dealing with, your body doesn't know the difference. So you end up being upregulated.
And the worst part is that people don't realize it, right? Or people deny it, right? I have in my intake questionnaire, I have 2 questions that say, do you have excess stress? Yes or no. And the second question says, do you manage it easily? Yes or no.
Yeah.
And I tell everybody, that's one of the first things I look at. But when I have the patients that write, do you have excess stress? No. Do you manage it easily? Yes. I'm just like, you're screwed.
Red
right?
flag.
Yeah, you're in denial, right? Like, I don't believe any of us don't have too much stress, right? So that to me, and it's not just your gut that gets shut down, but that also creates a syndrome called cortisol steal, right? Where all your cholesterol is being made into cortisol.
Right.
A woman ends up estrogen dominant, right? A man ends up with low testosterone, right? So it affects that.
Yeah.
It shuts down your liver from detoxing, right? So it's this perpetual, if we
and then
take
your
it back.
neurotransmitters, which are made in your gut, also tank.
Right. So if it all goes back to like one true root cause, that kind of is the big thing behind all of it. I really think it comes down to our mental, emotional, spiritual, social health, right? And for the people that can activate their parasympathetic nervous system, those are the people where like the detox happens, the treating Candida gets easier, treating SIBO gets easier, all of it happens. The hormones normalize.
What's your favorite way to help patients activate their parasympathetic? There's a lot of different approaches.
Yeah. I mean, I've personally recommended every patient I work with to work with a therapist while they're working with me. I know it's really hard sometimes to find a good therapist. I try to just get people to practice acceptance. For me, it's like if I can get them to just like flip that, hey, maybe I do have too much stress, right? Once they're aware there's a problem, you can't kind of ever go back, right? You always know it's there.
Yeah.
A really like objective tool is heart rate variability, right? So I'll have them wear a heart rate monitor, and you know, in real time, it shows you whether you're in the sympathetic or parasympathetic response. And a favorite story is I had this woman who was fighting with me about this, and she's like, I'm not stressed, like, you know, all this stuff, and she's like, and I started talking about HRV, and she goes, oh, my Apple Watch or whatever, her Garmin, whatever, she's like, it does that, and she goes, it's perfect. And she pulls it out, and I have a chart of like what's normal heart rate variability and what's stress. Yeah. And she's looking at it, and she's looking at me, and she just goes, oh no.
Oh no.
Oh no. And so it just showed she was in that sympathetic response all the time.
Yeah.
From personal experience, I mean, I know it's the hardest thing to deal with, right? It is. So I don't judge anyone for not wanting to deal with it, for, you know, for having a hard time with it. But for me, in my own experience, it's not a checklist thing either. It's not like, all right, I'm going to work on my mental health for the next 3 months and then I'm good, right? For me personally, it's a decision that I have to make every day when I wake up, is like, you know, I believe for me, it's spirituality and my belief in God. But I have to start my day with that. And I have to go back to that multiple times throughout the day to stay grounded and stay connected, because everything in my life kind of takes me out of that. Right.
Yeah, I agree with you. I feel like that's my anchor too. Like, just go back to, I mean, for me, it's reading scripture and, you know, really trying to form that relationship, and that allows, the anxiety and the stress to diminish, or at least to be managed, or at least I give it away to someone else in a way.
It's different for all of us, and it changes throughout life, right?
With different seasons.
Right. Exercise, yoga, talking, social group, there's so many different ways. And it's kind of, it's a hard journey, but it's like, it's a beautiful and rewarding journey for the people that can do it. Yeah.
I agree. I think that there's also some, useful tools that people can use in their home, kind of like you were talking about, probably the heart math, biofeedback tool. Yes. I like PEMF mats for my patients.
Oh, nice.
People really tend to do well with that. Just do it for 20 minutes before bed, and it just helps them relax. Yeah. I think deep belly breathing can also be helpful. Yes. Yeah. That's something we always can do no matter where we are, in the bathroom or in the car.
Right.
So I think that having a strategy around rescue for anxiety helps. And then, having a daily deep practice, whatever that may be.
Yeah.
It's been so wonderful talking to you, Dr. Koz. I want to let our viewers know how they can get in touch with you. So I think before we end, we just probably want to say that if you are going through fertility struggles, you're not alone.
No.
And there is hope. There are a lot of options that are not considered standard of care, but that are powerful and that are working for a lot of couples right now. And so I would really encourage people to dig a little deeper and to look a little bit broader for clinicians that can do this work. And can you tell us about where we can learn about your work, where patients can find you as well?
Yeah. So the easiest way to get a hold of me is my website. It's doc-koz.com. Mm-hmm. I got off of social media, so I don't do any social media. It was for my own mental health. On my website, there's links to get a hold of us. I've written 2 books, Unfunk Your Gut and Get the Funk Out, spelled with a C. We used to say in my practice, we put the funk in functional medicine.
That's awesome.
Those are, I think, the best ways to get a hold of me is just through my website.
Well, thank you so much for joining us today.
Thank you for having me. It's an honor.